My name is Angelito Agurilya. I'm one of the student nurse practitioners at Purdue Global. I'll be presenting my patient, Mr. Moses Sinclair. He's a 68 years old male who is seen in the clinic today complaining of pain to his right hand and unable to grab or hold things. He states he keeps dropping things for the past 3 months now, and pain is more worse and more localized to his right hand. He reported pain never goes away and it happens most of the time every day and it feels like an achy pain. Mr. Moses takes Tylenol extra strength 2 pills every 4 hours, and he tried also to rest his hand but with only minimal relief. He endorses pain 2 to 6 out of 10 for 3 months now. He has no known drug allergy and he denies any past medical or surgical history. He also denies any recent injury or trauma or any past hospitalization. His mother and his dad still alive. His mother has a history of stroke and his father has type 2 diabetes, and both of them are still okay and doing well. Mr. Sinclair is married and currently works as a tailor for the past 30 years. He denies any smoking or denies chewing tobacco, but he does drink 2 glasses of wine at least once a week with his wife at dinner time. He also denies using recreational drugs, and he reports feeling safe at home with good support system. On his 12-point review of systems, he's completely within normal limits, except he has pain and weakness in his right hand and his right wrist that affects his job as a tailor. On his recent vital sign as follows: temperature of 9.6, pulse of 75, blood pressure of 134/64 with a respiratory rate of 20. He is 6 feet tall and weighs 195 pounds with a BMI of 26.4. Patient denies any chest pain, shortness of breath, or dizziness. Upon my physical exam, he is positive on Tenelicyte and Palin's test. And on my palpation to his cervical spine revealed no masses or tenderness with a good range of movement. His cranial nerves 2 through 12 were intact upon assessment, and all his reflexes are all within normal limits and intact. He also normal and steady gait on my observation. Mr. Sinclair differential diagnosis carpal tunnel syndrome. It happens when the median nerve, which passes through the carpal tunnel in his wrist, becomes compressed. The other differential diagnosis is cervical radiculopathy, and this is a condition when a nerve in the neck is pinched and compressed, causing pain or numbness, and it radiates down to the arm into his hand. It may be caused by herniated disc or spinal degeneration. I may also consider he has diabetic peripheral neuropathy, and this condition causes tingling, numbness, and pain in his right hand or feet due to the damage from the long-term high blood sugar. Since Mr. Moses has a family history of diabetes on his father's side. The final diagnosis for Mr. Sinclair is carpal tunnel syndrome caused by compression or squeezing on the median nerve, and it's all related to his nature of work as a tailor, likely causing the pain and due to repetitive movements for quite a period of time. My plan of care for Mr. Sinclair is to advise him to wear a orthopedic wrist brace and to help immobilize the affected wrist and affected hand. And also he needs to continue to take Tylenol extra strength every 6 hours and may consider taking ibuprofen 400 to 600 milligram orally every 6 hours as needed with food, or he may take the Melox suspension for his stomach upset. If symptoms persist, he may start taking a short course of prednisone 20 milligram once a day for 5 to 7 days to reduce the inflammation. And then patient also needs to be referred to physical therapy for strengthening exercise and pain management. If no improvement in 6 to 8 weeks, Mr. Sinclair may refer to orthopedic specialist for further care. And Mr. Moses also needs to be followed up in my clinic in 3 to 4 weeks for evaluation and further treatment. Thank you.